When I got into this program, I wasn't even sure if nursing was going to be for me. My father actually passed away when I was 20 years old of cancer, and I watched how some of the nurses gave him care and compassion, and it really drove me to that profession. We weren't always sure when you come to college or what you're going to do. You might get 2 years into your college degree and be like, you know what, that's not for me, I'm going to shift it, and that's okay. Because in college here, you can go into a different, degree, and I chose nursing, and I will never look back from that. I went to Saline Memorial Hospital and started out as a med-surg nurse. I became the market clinical recruiter. My job is to continue to find good nurses and other staff members to help in our hospital needs. I come right back here to the old stomping grounds, and I know they're going to produce some good nurses. They helped me become a professional. They helped me learn how to be a nurse, how to show that passion and love I had for people in an appropriate manner as a nurse. I think one of the best things that the UA Little Rock nursing program does is our simulation labs and the hands-on training that our teachers give us. They're seeing real life situations, but in a controlled simulation environment. If you have a passion for people, to help people, to love on people, to take someone in one of their darkest and worst times of their life and help them get through that, nursing is your situation in your career you want to go to. There's so many different fields in nursing and opportunities. Being a nursing home where maybe it's a slower pace, but you're dealing with 30 patients, or you can be in an ICU where maybe it's a very fast patient, or dealing with just 2 patients. Who makes a good nurse? Someone that listens, someone that advocates for their patient, someone that goes up and beyond for their patient, and whether it's just taking that moment to listen to them, to talk with them, holding their hand, giving them a hug. These are things that aren't necessarily coming from a book, but these are things that you should do for a patient that will help them and help them physically get better, help them emotionally get better. This school in particular will set you up for those successes.